Bye-bye, say bye-bye.
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 Whether caring for parents, grandparents or partners as they age, how best to help the elderly and those with dementia is a question that affects everyone.
If I hug her, she pushes me away because I'm a stranger, you know.
Around the world, people are living longer, but many governments spend very little on long-term care for the elderly. And COVID-19 has brought things to crisis point.
More deaths in care homes than in hospitals.
The care assistants have moved in so they can keep the virus out.
1 in 4 residents here now dead.
The pandemic has sort of highlighted everything that is wrong with institutional care.
Across the rich world, around half of COVID-19 deaths have been in care homes, despite the fact just under 1% of people live in them. But the pandemic also offers a unique opportunity to rethink care. And the devastation caused by COVID-19 could be a tipping point in how societies treat their old people.
What do you find challenging? It's not remembering things, isn't it?
No.
It's not following conversations.
Things like forgetfulness, or say, I forget things so here and there.
The challenges of caring for people as they age will affect everyone.
Yeah, because you didn't have that on
No,
properly.
it's not properly.
If not now, then soon.
There's something wrong.
The share of people over 80 is expected to double in the next 30 years. And at the same time, there will be fewer people of working age to look after the elderly, especially in the rich world. Take Spain. For every 10 working age people in the country today, there are currently 3 people over retirement age. By 2050, there will be 8. Close to a 1-to-1 ratio.
We are tipping into sort of being 65 plus societies. There is a simple question of who is going to look after these people in a dignified way.
The cost of care is a major factor in these decisions. In America alone, almost half of those who reach the age of 65 will need some form of paid care. And as these costs are highest in rich countries, one solution could be to outsource care internationally. This is Ban Kamlang Chai in northern Thailand. It's home to 14 residents from Germany and Switzerland. Maya is the youngest resident, at 60. She was diagnosed with dementia 10 years ago.
I said to her, you know, I promise you, Maya, I will do always the best. You don't have to worry. I promise you that.
The care system in much of Europe means it's often family members who take on the burden of care. And Maya came to Thailand when her husband Walter could no longer look after her.
I realize if I carry on with this, I will die before Maya. I will be flat in a few months. And the children told me also, you better do something now, because you cannot do both, work and taking care of your wife.
All the residents here have dementia, and across the world it's thought between 1/3 and 1/2 of those 85 or older have the condition. There is no cure, and the global cost of dementia by 2030 will be a staggering $2 trillion every year. Residents with dementia here have 3 carers each, providing around-the-clock care for a fraction of the equivalent cost in Switzerland. But not everyone approves of sending loved ones to the other side of the world.
Well, I got a letter from a school friend of my wife. She told me I'm a big idiot, disposing my wife in Thailand, and I'm stingy. It's the best thing we could have done. There's shortage of staff like everywhere in Europe in these care homes. Nobody has time to really look after her. She deserves better than just put in a corner and look at the wall.
The centre was founded by Swiss entrepreneur Martin Woodley after his own mother was diagnosed with dementia.
Are you hungry?
A little bit.
Okay, then let's go.
It's one of several care centres in northern Thailand that market their services to Europeans.
Here in our village, what we try to do, we try to make the atmosphere like just normal life in a village. Komm, wir gehen mal nach oben. I would wish that it would be possible, much more going back to the family, much more going back to the community system and solve the problem in that way.
What are you doing? You're buying chocolate?
Yeah.
But few communities in the West can provide this type of one-on-one care. And personalised nursing like this is only available to the very richest people.
Was hast du für einen süßen Po?
So some care providers are looking for other ways to keep people at home and in their communities for longer.
Thank you.
Thousands of miles away in southern England,
Your turn.
Afzal and his wife Zora are part of a pilot scheme to help dementia sufferers live longer and healthier lives at home.
Your turn.
I think he would only be ready to go into a care home if he was so bad he wouldn't even know he was in a care home.
I hope it never comes.
Yes.
In much of the rich world, a significant portion of long-term care is provided in care homes. But the practice of caring for people in large institutions as they age has been called into question by the pandemic, which left many care home residents cut off from family and at increased risk of disease. Across the rich world, around half of all COVID-19 deaths occurred in care homes. And in Canada and Australia, the estimated figure is closer to 80%.
We have institutionalised care, but both COVID as well as just the fact that life is much longer than we ever thought it would be, mean that experts are starting to question whether that is really the best way to deliver care.
Many experts now believe around half of the care provided in care homes could be done at home. Technology can help. Afzal has dementia, and there are sensors fitted around his home to track his movements. The data gathered by the sensors are fed back to a remote monitoring team, along with medical readings like Afzal's blood pressure and temperature.
I've never seen that red light before. Retry.
Retry. What's happening?
It means there's somebody watching all the time. That's very reassuring. The monitoring team would then know that the patient is eating, is drinking, is looking after themselves, or the carer's looking after them.
When I do some cooking or something, I leave the fire on. That's very helpful.
The support of the remote monitoring team helps relieve some of the pressures on unpaid carers like Zora and save money for overstretched health systems.
Looks like it's come up to about 90 and then dropped down again.
It looks like they repeated it and it came back as normal.
Real-time data from Afzal's home is collected here, and if they notice changes to temperature or blood pressure that might indicate infection, they're able to intervene early and prevent costly hospital admissions.
1 in 4 hospital beds are currently being occupied with people with dementia. And because the current service can't cope with the increasing number and the resources that require, we need to bring a new model of working. So with this model, with 3 to 4 monitors, we were able to monitor 500 people, something that is impossible to do in a normal outpatient appointment.
But while technology like this can reduce the ratio of carers to patients, it can't fully tackle the fundamental problem. There simply are not enough people to look after the elderly.
There are shortages of carers everywhere. Why might that be? Well, number of reasons. One, we don't look after carers very well at all. So pay is one of the most obvious things. In Britain, social carers tend to be paid less than people who work in supermarkets. The demand on people who work on it, the stress levels, the injury levels, etc., are just very, very high. If you add those two things up, you might think, well, there are easier ways to make your money.
In Germany, a third of care workers leave their job after a year. And in most rich countries, a care home worker is paid 36% less than someone doing a similar job in a hospital. Changing the way the elderly are cared for will require profound political and structural upheaval. But it's just possible the pandemic could provide the necessary momentum.
It's never going to win you an election, and so politicians will pass the potato on and on and on and on and on. And maybe COVID will be that moment. Maybe COVID will be that moment where you just can't ignore it any longer. I certainly hope so. I'm Sasha Nauta, Public Policy Editor at The Economist. This film was inspired by a piece that I wrote about how COVID-19 was highlighting the flaws of elderly care. To read it, please click on this link. Thanks for watching, and don't forget to subscribe.